EECP, or Enhanced External Counterpulsation, is a relatively new and certainly innovative approach at treating angina, or chest pain associated with reduced blood flow to the heart. This is usually due to blockages or obstruction in the coronary arteries, the blood vessels that supply the heart with the oxygen and blood that it needs to continue functioning properly. EECP works to increase the blood flow to the heart and facilitate blood flow and oxygenation to the rest of the body as well, which takes a lot of stress off of the heart and results in symptomatic relief. Now, to understand this process, it's important to understand that the heart, just like other vital organs, tissues, and cells throughout our body, requires a continuous supply of blood flow and oxygenation to continue functioning properly. And our heart receives the blood and oxygen it needs from a network of small arteries called the coronary arteries. I like to think of the coronary arteries as these big 4-lane highways, and blood flow and oxygen as precious cargo being transported down these roads that eventually lead to the heart. Normally, and ideally, these highways are unobstructed. There are no other cars on the road, no traffic, no roadblocks to slow them down or impede the flow. So the trucks reach the heart quickly and efficiently and are able to deliver the cargo, the blood, oxygen, and other nutrients, to the heart without difficulty. And therefore, the heart muscle can continue to function properly without becoming overly fatigued. However, sometimes these roads do get blocked. Some of us may have plaques or blockages within our coronary arteries. Some of us, instead of having these nice big open 4-lane highways, may have only one lane open, which can significantly impede the flow of traffic, resulting in reduced blood flow and limited oxygenation of the heart muscle. This reduction in blood flow is known as ischemia, and in these instances, patients can experience certain signs or symptoms associated with the reduced coronary blood flow. Not all patients, though, experience the typical chest pain or angina associated with ischemia. Some patients may experience shortness of breath or other signs or symptoms that really limit their exertional capacity, and EECP can help with these symptoms as well. Treatment consists of 35 sessions lasting 1 hour each. Patients come to our clinic 4 days a week, Monday through Thursday, to participate, allowing them to complete their treatment in just under 9 weeks. During each session, the patient will lie back on a comfortable treatment table and will secure a series of 3 Velcro cuffs, essentially very large blood pressure cuffs, around the patient's calves, thighs, and upper thighs. We also place a few stickers on the patient's chest to monitor their heartbeat throughout the session, and a sensor is placed on their finger as well, which helps guide the treatments by monitoring blood pressures. As the treatment begins, the cuffs will begin to inflate and deflate rapidly and repetitively in a sequential motion from the calves to the upper thighs, essentially propelling the blood upwards back into the heart. The cuffs are actually programmed to inflate and deflate in sync with your heartbeat. They are designed to quickly inflate every time your heart relaxes, when the heart normally receives its supply of blood and oxygen, and EECP works to augment that flow. The amount of pressure applied to the patient's legs is gradually increased, and this process lasts for the entire hour. EECP has been shown to stimulate the formation of collateral blood flow, essentially creating a natural bypass around narrowed or blocked vessels. This has been demonstrated by several studies revealing significant improvement in coronary perfusion, as demonstrated by various imaging modalities. Here, we see nuclear imaging of the heart before and after EECP, and you'll notice that the bottom picture is much brighter. This is due to the increased perfusion of the heart muscle following EECP. In addition to symptomatic improvement, many note dramatic improvement in their energy levels, and this is because EECP mimics the beneficial effects of exercise. In fact, some famous athletes actually have EECP beds in their homes and use them frequently. Other upcoming indications and uses for EECP include heart failure and erectile dysfunction, and this is because EECP improves blood flow everywhere, not just in the heart. Many patients begin noticing improvement in their symptoms after the first 3 weeks of treatment, and after completing the 35-hour treatment course, about 75 to 80% of patients experience significant symptomatic relief that may last up to 3 years. Upon completion, many patients report an improved quality of life and require fewer medications. If your symptoms do return, luckily you can repeat EECP every 2 years. And EECP treatments are actually very relaxing. I actually completed a treatment session a few weeks ago just to kind of get a sense of what my patients were going through when they're doing EECP, and I found it very relaxing. I know many patients will lie there and fall asleep, take naps, listen to music, or even read a book during their treatment sessions. And it's a good time really to just lie back, relax, and get some symptomatic relief with EECP while you're doing it. So many patients really enjoy it, and I know I did. EECP has proven to be a safe, simple, non-invasive, and effective approach at treating angina and improving coronary blood flow. And Saline Heart Group is proud to say that we're one of few sites in the state of Arkansas offering EECP therapy.